Thank you for your time and attention. Today I will talk about the social validity paradigm. Firstly, I will provide an overview of the social validity paradigm. Then I will explore the four elements of the program. Next, I will provide an example of how the social validity paradigm can be used by counselors. Lastly, I will explore how this paradigm can be used in Canada in the present. What is the social validity paradigm and why it is helpful? To start, I will describe my friend's grandmother. She was originally from China and had to come to Canada to settle with the rest of the family. She was quite old and had trouble adjusting to life in Canada. She became depressed and talked about wanting to go back home. She spent a lot of time trying to make herself useful, such as by cooking enormous amounts of food and constantly cleaning. Finally, they took her to see a doctor, and he told the family that she was suffering from culture shock and homesickness. And was natural. However, the grandmother claimed that everything was fine and that she did not need any help. The concepts of homesickness and culture shock did not make sense to her. She understood them, but claimed they were not a problem, and she could not understand why they were so upset she was cooking and cleaning a lot. This is where the social validity paradigm is helpful. The social validity paradigm is helpful for developing culturally appropriate responses in psychological theorizing and treatment because it would be accessible to the patient. This takes into account the judgments about the treatment procedures by non-professionals, laypersons, clients, and other potential clients. The acceptance of that treatment largely depends on the cultures and the backgrounds of the people. The four elements of the program are that the patient has to believe there is a problem. The severity of that problem is agreed upon, that the treatment is acceptable to them socially, and that the outcome is valued by the client. The first element of the program is that the patient has to believe that there is a problem. If they come from a culture where an issue is not seen as a problem, the counselor will basically be forcing them to accept that there is one. The second element is that they must accept that the issue is severe enough to need intervention. If they are pressured into interventions, it might actually hasten it and make it more consuming to them. The third element is that the treatment is that it is acceptable to them socially. The counselor needs to find ways to treat them in ways that are comfortable and acceptable to them. The fourth element is that the outcome has to be valued by the patient. A framework can be developed in which these elements are taken into consideration. Earlier in the course, we learned about the friendship bench. This was an idea for grandmas in Zimbabwe to help meet with people who need ways to deal with mental health issues. The grandmas were trained by professionals to help others using cognitive behavioral techniques. It has 6 sessions and will try to convince people to join a community support center. This is a good example of the social validity program. People go to the counselors, which means they view the issue as something they need to deal with. They accept the severity of the issue to be there. The treatment is suggested to them and must be accepted by them. Lastly, they themselves see the need for the outcome and will accept it. This is a form of counseling and that takes into account the needs of the client in a way that is important to them, and within a cultural apparatus that is known to them and acceptable to them. The first objections to a friendship bench in Canada is that it is too cold to have something like that in most of the country most of the time. Of course, I am joking, but what I mean to say is that it would need to be adapted. To go back to the case of my friend's grandmother, instead of her family dragging her to a counselor and placing her in a setting which she is not comfortable with it might be a better idea to do it in a setting that she can share her thoughts. There could be social groups where she can use her language. The issue itself does not have to be presented as an issue, but as something that is felt by all immigrants, and that there are resources to help. There are many approaches that can be taken in a way that fits the social validity paradigm, in which she would accept she needs help and values the treatment and outcomes in a way that is comfortable for her. In other words, we can avoid psychologizing and instead meet them where they want to be met. This concludes my presentation. Thank you for your time and attention.